Hi there, my name is Adrian Urquiola, and this is my presentation on HIV and AIDS in San Francisco. So a little bit of background information on San Francisco. The city is located in Northern California, and as of 2022, San Francisco has a population of just over 800,000 residents. The city covers a land area of 46.9 square miles. So HIV, what is this? So the human immunodeficiency virus is a virus that attacks cells that helps the body fight infection, so it suppresses the immune system. HIV attacks and destroys CD4 T lymphocytes, which are a type of white blood cells. HIV uses the CD4 cells to multiply and spread throughout the body. So modes of transmission, there are many different types of modes of transmission. You have blood, semen, rectal fluid, vaginal fluid, and as well as breast milk. For transmission to occur, the HIV in these fluids must get into the bloodstream of an HIV negative person through a mucous membrane, through open cuts or sores, or by a direct injection from a needle or a syringe. So San Francisco HIV outbreak. The HIV/AIDS epidemic hit San Francisco in July of 1981. Dr. Michael Gottlieb was one of the first to report identifying the appearance of this disease, which we all know now as AIDS. And the University of San Francisco's Dr. Paul Volberding, he saw his first patient with a rare cancer known as Kaposi sarcoma, which later was found out that was linked to AIDS. And on July 3rd, the CDC of that same year of 1981, the CDC reported 26 gay men ranging from 26 to 51 who have been diagnosed with Kaposi sarcoma in the past 30 months, and 8 died within the first 24 months. So method of surveillance, there are different ways that the city and the Department of Health in San Francisco uses methods of surveillance. You have HIV case surveillance, medical monitoring project, and the National HIV Behavioral Surveillance System. So for the HIV case surveillance, this involves having healthcare providers and clinical laboratories provide HIV case surveillance data to local health jurisdictions and to the Office of AIDS as a routine public health activity required by law in the state of California. The Medical Monitoring Project is a surveillance project designed to produce nationally representative data about the health-related experiences and needs of persons living with HIV in the United States as well as in California. The National HIV Behavioral Surveillance System is a national health survey that collects information on sexual risk, drug use, HIV testing behaviors, and HIV prevalence from population at high risk for HIV infection. The epidemiology of HIV and AIDS in San Francisco. So as of December 2022, there are 15,537 people in San Francisco that are living with HIV. 157 were diagnosed with HIV in 2022. The majority of those people being cis men, Latinos, and men who have sex with men. When it breaks down a little bit more to the race and ethnicity, you have 8,721 white individuals living with HIV in San Francisco, 1,778 Black and African American living with HIV, 3,367 Latinos living with HIV, 1,000, a little bit over 1,000 Asian Pacific Islanders living with HIV, 62 Native Americans, and 557 multi-race individuals living with HIV in San Francisco. So implemented preventative measures. Let me see here. So you have by using condoms. So there are many different places around San Francisco that offer free condoms, like the San Francisco City Clinic, the Department of Health in San Francisco, and the New Generational Health Center. For PrEP, pre-exposure prophylaxis, this involves taking a specific HIV medicine every day or an injectable HIV medicine every 2 months to reduce the risk of getting HIV through sex or injection drug use. The San Francisco City Clinic is a great source of this medicine or a resource for other places to have it as well. For sterilization, you have the San Francisco AIDS Foundation, which gives out clean needles at their offices, and they also have mobile sites each day of the week. You also have prenatal transmission. So by preventing this, there's different medications that you can get to the mother. So when the baby is born, they won't have or very low chance of getting that HIV transmission going, and then getting tested as well. The CDC actually suggests to get tested at least once for HIV, more if you're in a high risk population, but for sure at least once in your lifetime. Oh, barriers. So you have different types of barriers. You have stigma, you have financial and lack of medical insurance, and lack of knowledge. For stigma, due to this stigma, people are not getting the care that they need promptly. And because of this, they are not initiating HIV care when they are HIV positive. For financial, when finding out people are HIV positive, become frightened because of the financial portion that disease might carry. People have to get on medication, anti-retrieval therapy, and it can be a little bit expensive, and people don't want to go into that route because of that. And they might be scared as well because they don't have medical insurance. Again, it's that cost. They're not 100% sure what that cost is going to be and if it's going to be a strain on themselves or even their families. And you have lack of knowledge. There are a lot of different resources out there, and people just don't know them, specifically in San Francisco. And again, there are options that you can get help, medical help for either little to no cost. So the help is out there, and getting that knowledge out there is very important. So my preventive method design would focus on two different areas. It would be awareness and education. I would first want to reach out to those targeted audience that have high new HIV diagnosis within the city of San Francisco. I would want to run a media campaign, and those media campaigns will be on billboards, bus wraps, and social media. And the advertisement would have facts about local HIV data of San Francisco, and also have a website and number if for resources or if they need information, we'll have that there for them as well. The implementation strategy would be going to community centers in those high risk areas and offering monthly presentations and education on HIV. On that same time of the presentation, there will also be free HIV testing with instant result as well. So my preventive method continuing, this is a multi-agency collaboration that we need to work together for it to be successful. We would have the Department of Health of San Francisco, and what they would do is be getting a grant so we can actually get money for the advertisement spaces, going to pay the nurses and the people who are going to be doing the presentations as well. The foundation Getting to Zero San Francisco will be helping out by providing personnel who are able to go into those high-risk population areas and provide education to the public on a monthly basis. And then the San Francisco City Clinic will be again providing personnel, most likely a nurse or nurses, who can provide rapid HIV testing in those facilities where we're doing the presentation as well. And these are my references. So you can see here. And then, oh, right here as well. And thank you, and that is it for the presentation.